Alzheimer's and the various other manifestations of dementia are quickly becoming the most serious and widespread public health problem in the United States. To the population of 5 million people with Alzheimer's, add 15 million family members and caregivers whose lives are profoundly disrupted by the consequences of the disease. Then add the untold millions of people who fear getting Alzheimer's and watch for signs, pay attention to every medical development, seek out the results of every experimental drug test. In these times, millions and millions of people each year pay attention to what comes out of the annual Alzheimer's Association International Conference in Washington. And the well-timed headline from the marketers at drug maker Eli Lilly this time around say very preliminary data suggest a new drug might be able to slow down the onset of Alzheimer's by slowing the development of what's called amyloid plaque buildup in the brain. Joining us now, Dr. David Kramer, a retired emergency physician who was diagnosed with early-onset Alzheimer's disease in 2012. Welcome, Doctor.
Thank you.
And Meryl Comer is with us. She's been an Alzheimer's caregiver for 20 years. Her husband, a former research physician at the National Institutes of Health, was diagnosed with early-onset Alzheimer's at the age of 57. Meryl cares for him at home, along with her mother, who also has the disease. Meryl, welcome to you.
Thank you.
Now, to both of you, and just giving kind of a yes or no here, you follow this stuff like every detail, right?
Passionately, yeah.
Exactly. I can hear it. Dr. Kramer, what's your reaction to the Eli Lilly preliminary results here? Is it a hope? Is it a caution? Is it a here we go again?
Well, it's all of the above. I will have some preliminary optimism with the results, but I had the opportunity to read the paper on the study that was discussed and presented yesterday. And the data is very, very preliminary, and there's not any clear evidence from what I've been able to see that this is going to have a long-term effect, but it is way too soon to tell.
And Meryl, how do you deal with these way too soon to tell but positive details? Is it hope? Is it yes? Is it oh no? I mean, I don't know how it must be emotionally for you to follow these things.
Well, I'm neither a scientist nor a neurologist, but I've been at the bedside, as you said, for 20 years. So I'm looking at the hope, because what I see is that it's promising but premature, and people tend to read the headlines only. So we'll receive calls and saying, good news, your problems are over. Well, they don't understand the complexity of the disease. It's easier to get to Mars than find a disease-modifying therapy for a very complex issue like Alzheimer's. What's exciting to me is that the companies, we need to applaud the companies like Lilly and Biogen and Roche and Merck that are staying in the game. You know, we went through a phase where after these failed trials, we were afraid that we would be abandoned at a time when the numbers are growing exponentially at 44 million globally, suffering with the disease. So the other hopeful part is there are 13 new therapeutic compounds, and 4 or 5 are disease-modifying therapies. And I stay close to the science, as do all advocates, because we are desperate for a disease-modifying therapy. Give us 5 more years of quality of life, John, and think what that might mean to an individual.
But Dr. Kramer, don't those numbers that Meryl talks about there, the millions with the disease, the millions more caregivers and family members like Meryl, and then the millions and millions and millions of people who are scared of getting the disease. I mean, Big Pharma could develop avocado pits. It might prevent Alzheimer's, and millions of people would buy it.
Careful, John.
I think you're right. And I think that there's a difference between hope and false hope. Don't get me going about the supplements that are touted by people who are interested primarily in their own pocketbooks. I think that, as mentioned, these are very preliminary studies. These drugs, even if they make it through phase 3 trials, will be available years from now. So, we're talking about something that is clearly in the future. And while these may have potential, even after the phase 3 trials are done, you still do not know whether the effect will be long-lasting, whether the slowdown in the progression of the disease, if it actually does occur, will be consistent over time. So there's a lot to learn. There's a lot to learn as far as side effects uh, of the medicines and so forth. From my perspective, it's all about quality of life, and everything I do is about maintaining the highest quality of life now while I can still enjoy it.
What's it like to get that diagnosis, David? And how is it? Is it a powerlessness you feel knowing that there's some sort of time out there where your life is going to fundamentally change, even as you fight for quality right now?
I do not feel powerless. I feel that it's important for me to enjoy the time that I have now. My wife and I focus on doing everything that we can now and enjoying life. There's a definite benefit in having an early diagnosis, as I was fortunate to have, in that I can then say, all right, I know what I've got, but I'm doing well now. And as long as I can continue to do well and live well with the disease, I plan on doing that.
Out of the latest Alzheimer's facts and figures, 50% of doctors refuse to diagnose because they have nothing to offer their patients, and they don't want to depress them. But when you hear that the quality of life you're grabbing for as long as you can have it is important, let the families decide. Give us the diagnosis. Don't be paternalistic about what we can manage. We have to manage the very tricky space of not knowing whether a loved one is sick, how sick they are. My husband was misdiagnosed for 4 years. Depression, Lyme's disease, go take a vacation. It's insulting to families, and we're lost and confounded by behaviors because behaviors are the first things that appear around the disease. And smart people, like both the doctor and my husband, hide out in the disease for a long time. So I think it's very incumbent that we have to say early diagnosis, give us a chance to live the moment with our loved ones. Don't decide for us.
I agree.
Meryl, it seems to me, and maybe I'm just feeling ghoulish here, but that if you're grasping for a quality of life, you're essentially trying to collect memories that you know are going to vanish on some level. That just seems so poignant. How does that work actually in the way that you interact with your family members and loved ones?
You try to live in the moment. Much easier said than done. Often you're moving from crisis to crisis. You have to go with the disease. I mean, my husband became the stranger. The disease was the stranger that I was dancing around, unpredictable, dynamic. So you really try to look at the successes, that he had a good day, or the caregiver actually forgets who they are because you are so focused on protecting the dignity of a loved one who has the disease, of giving them their last hurrah. That takes tremendous energy. And what we're learning is the caregivers are getting sick because of the disease progression. This is a disease that can run from 3 and I'm into 20 years. The doctors just don't know. But these early onset victims, and there are about 200,000 that we know of it right now. But then you also have the advanced aging, which are huge numbers. So this whole dynamic of the families, this is the biggest women's issue since breast cancer. I mean, we outlive men statistically. We're more prone to get it, and the research doesn't know why. And they're just beginning to look at sex-based differences. The issue is whether they use female mice and rats in their studies. And historically, they haven't used female mouse because we are high maintenance. We're more expensive to study. We are more complex because of the hormones. And we get angry when caged. So the notion that we really have to start looking at sex-based differences in this disease because men and women do present differently. We progress faster into the disease, and we are 2/3 the caregivers across ethnicities. And the idea that the caregiver is getting sick, everything's predicated on the fact we're going to be healthy. We're the first with hypertension, first heart attacks. And because of the intensity of care over years, we are 6 times more likely to get dementia ourselves. Now, that statistic really makes me angry.
John, I'd like to emphasize that point also, because I'll tell you that um, I interact a lot with many, many people with dementia. And I'll tell you that the primary concern that all of us to an individual have is about the health and welfare of our caregivers. And I'm much more concerned about the impact of this disease on my wife than I am of the impact on myself. So that is absolutely key, and I totally agree with Meryl regarding that. I did want to mention real quickly with regard to the numbers of people with early onset disease that I believe that those numbers are actually undercalling the total with early onset. I think there are a lot of closeted people with dementia because they're embarrassed, because they might not have the financial means, they might be afraid of losing their friends, they might be afraid of losing their jobs, which they cannot afford to, and so forth. And since so many people are in denial and other factors, I actually believe that the true number of people with early onset is a lot higher than currently reported.
David, before we go, just to get off the numbers for a second, and you've given some amazing numbers for us to think about here. I have this idea of you, organizing your life around quality and being in the moment, David, of, you climbing some summit and staring out and wanting somehow knowing that memory might go away, trying to sort of glue it more firmly inside your skull somehow. Yes, you're worried about your wife, but what does it feel like to be acquiring memories that will fade long before you actually leave the planet?
Oh boy. It's not something that I worry about on a day-to-day basis, to be perfectly honest.
Glad to hear it.
I am in a situation now where, the reality is that my short-term memory is, not nearly what it was. I'll be totally honest with you, and my wife and I laugh at a lot of the things that happen. I'll tell her the same story time and time again, and she always says that I say it in the same way with the same sense of humor. She says it's still Dave. So, we just try to take the best light and look at things in the best way that we possibly can and enjoy the day-to-day life that we have.
Meryl Comer and Dr. David Kramer, thanks so much for spending this time with us.
It was a pleasure.
A pleasure. Thank you.
Meryl Comer is Alzheimer's caregiver and author of Slow Dancing with a Stranger, a best-selling book about her husband's early onset diagnosis, the proceeds of which all go to Alzheimer's research. She also cares for her mother who has the disease. Dr. David Kramer is a retired emergency physician who was diagnosed with early onset Alzheimer's disease in 2012.